My presentation is on STDs and STIs in college students. Now, STDs and STIs are predominantly found more in college students because they are normally more sexually active. Normally, individuals within the age range between about 16 and 24 is where these are most commonly found, yet this does fall a little lower within the age range. Yet my focus today will be those who are in college. Now, what is the difference between an STI and an STD? Overall, both are very similar to one another. It's kind of an umbrella term, yet STI stands for sexually transmitted infections, where STDs stand for sexually transmitted diseases. STIs are normally more asymptomatic, where STDs, normally you kind of see those symptoms more, the symptoms are more present in your body. STIs are caused by bacteria, viruses, or parasites, and are usually transmitted through that sexual activity or that sexual intercourse. Um, any bodily fluids or skin to skin contact. This can even be through sharing chapstick with an individual who is infected with that STI, sharing a drink. Honestly, anything that is like exchanging that saliva or any way you come in contact with that infection. Now, an STD kind of stems from an STI, and it's kind of those pathogens, and it disrupts those normally bodily functions. So, an STI turns into an STD if it's not treated. Um, but yet again, overall, both are very similar to one another, and essentially they are kind of the same thing, but they have those like slight differences. Now, how prominent is it in college students? Again, this is the age range where STIs and STDs are more commonly found. About 1 in 4 college students do have these sexually transmitted diseases, because this is the age range where those individuals are more sexually active, yet many are unaware of um, if they have the STDs or not, because a lot of times they fall under the asymptomatic category and they're unaware that they might have one. That's why it is very important to go get tested. Now, there are many different types of STIs or STDs that you can get. There are 30 different types you can get, and more. Yet the most commonly ones that are found is HPV, herpes, syphilis, sorry if I pronounced this wrong, trichomoniasis, gonorrhea, chlamydia, and HIV. There are incurable STDs. You can take medicines to kind of maintain them, but they will never essentially go away. And these include hepatitis B, herpes, HIV, and HPV. And then others include scabies, pubic lice, and then the genital warts kind of falls under the HPV category. But yet again, there are many more that aren't listed on this slide. Kind of just going over those more commonly found ones. HPV, I'm not going to pronounce that because I do not want to butcher it, but it's kind of those warts you can find. Normally they're found in like the genital area, mouth, or throat. And again, in these areas, you can find warts, unusual growths, lumps, and sores. And you can obtain this again by having that intercourse with someone, so vaginal, anal, or oral sex with someone who has the virus. And you can even develop these symptoms years after having sex with that infected person. And then you can prevent this with either getting vaccinated or, again, just being safe and using condoms. Herpes, this is another common one found. Genital herpes is caused by 2 different viruses. HSV1, this causes oral herpes, so kind of cold sores, fever blisters, and then HV2, which is kind of more of that genital. Again, this is caused by sexual intercourse or exchange of that saliva, and more. And then again, this is one that there is no cure for, but there are medicines that can help make it less likely for you to pass it to someone else. Syphilis has multiple different stages: primary, secondary, latent, and tertiary. And each stage has different types of symptoms that can occur. So, the primary stage, normally you see like sores. Secondary stage, you can kind of see rashes. The latent stage, there's no like visible signs. And then most people with untreated syphilis, you don't develop, it doesn't really develop into tertiary. And then without treatment, it can spread to the brain and nervous system and affect your eyes. You can get headaches, etc. And it can spread through intercourse. And also, if you're pregnant, it can spread to your child. And then you can prevent this with using protection and also just getting tested. Trichomoniasis, again, sorry if I pronounced that wrong. This is kind of like a parasite in you, and most individuals do not realize they have it. Symptoms in med may include itching or irritation inside the penis, burning, or kind of like more discharge. Women may also notice burning, soreness, discomfort, etc. And then unprotected sex can cause this disease, and it can be treated with pills. Gonorrhea, this is infection of the genitals, rectum, and throat. Symptoms in women can include painful or burning sensation when peeing, increased vaginal discharge, vaginal bleeding between periods. Symptoms in men also can include burning sensations when peeing, discolored discharge, or painful or swollen testicles. Can also be spread through sexual intercourse. And then there's also medicine to cure gonorrhea. And then chlamydia. This one actually can cause permanent damage to a woman's reproductive system and can cause you to even not be able to have a child when you're older. Oftentimes, this one has no symptoms, but if symptoms do show up, you can have abnormal vaginal discharge in women, burning sensations when peeing, and in men, there's often discharge from their penis, burning sensations when you're peeing as well, or pain and swelling in one or both testicles. Again, this one's also spread through sexual intercourse, and this one can be treated with medicine. And then HIV attacks the body's immune system, and without getting treated, it can lead to AIDS. And the only way to know is if you get tested. And normally there's not symptoms, but if there are, they can be flu-like. And ways to prevent this is just using condoms, not sharing needles. There is no cure, but proper medical care can control the virus. How you can get rid of them, again, just always getting tested regularly. Again, medical care. You can take medicines for those that can be cured, like antibiotics, or the ones that can't be cured, you can kind of maintain your lifestyle with them to help just not spread them to other people by taking those medicines. And then how you can prevent them: always use protection, getting tested regularly so you don't spread it to other people, getting those vaccines, avoid recreational drugs, limiting your sexual partners, and then communication between you and your sexual partner to make sure you both are tested, both are cleaned is very important, especially if you have multiple partners you are having intercourse with, is very important. And there are my sources.